Según la Organización Mundial de la Salud, una enfermedad rara afecta a menos de 1 de cada 2.000 personas. Pero en conjunto, más de 300 millones de personas en el mundo viven con alguna de las más de 7.000 enfermedades raras conocidas. En nuestra región de las Américas, esto significa que millones de personas y familias enfrentan la incertidumbre, la complejidad y el aislamiento que estas enfermedades pueden provocar. Más del 70% de estas condiciones comienzan en la infancia, lo que hace que nuestra respuesta sea aún más urgente. Los principales desafíos que enfrentamos se relacionan con el reto estructural de los sistemas de salud en las Américas. El reto más significativo es quizás la capacidad de diagnóstico, sea el diagnóstico tardío o inexistente. Puede tomar más de 5 años identificar correctamente una enfermedad rara y en muchos casos nunca se logra. Este retraso es aún mayor en comunidades rurales o desentendidas, en personas viviendo en condiciones de alta vulnerabilidad, donde para ellos los servicios diagnósticos especializados son escasos o inexistentes. Además, estas enfermedades suelen ser complejas, multisistémicas y requieren atención multidisciplinaria, pero nuestros sistemas de salud no siempre están preparados para ofrecerla. Seguimos apoyando a los países de parte de la OPS en la implementación de programas universales de tamizaje neonatal, el desarrollo de registros nacionales de enfermedades raras y en la inversión en infraestructura diagnóstica, incluyendo telemedicina, plataformas digitales que conecten el conocimiento especializado con las comunidades que más lo necesitan. El segundo gran desafío es el acceso al tratamiento. Incluso cuando se logra un diagnóstico, el tratamiento puede ser no estar disponible y si lo está, puede ser inaccesible por su alto costo. Más del 90% de las enfermedades raras no tienen un tratamiento aprobado y para las que sí lo tienen, el costo puede terminar en representar un gasto catastrófico por la persona, la familia y la comunidad. Debemos abogar por políticas que incluyan los medicamentos y tecnologías para enfermedades raras en los planes nacionales de salud, incorporado en los planes de beneficio, basado en ciencia y evidencia. Además, es necesario fomentar la producción local de fármacos esenciales y negociar modelos de precios justos para garantizar la asequibilidad y el acceso para todos. Tampoco podemos olvidar el impacto de las enfermedades raras en la salud mental, la educación, el empleo y la participación social. Las personas que viven con estas condiciones y sus familias enfrentan con frecuencia aislamiento, estigmatización y discriminación. Esta realidad es aún más dura en comunidades marginadas y afecta de forma particular a mujeres y niños. Necesitamos un enfoque integral, centrado en la persona que no solo trata de enfermedad, sino que apoya al individuo en su totalidad. Los servicios de salud mental, las adaptaciones escolares, la inclusión laboral y la infraestructura accesible deben ser parte de una estrategia completa para enfermedades raras. En las Américas no contamos con datos consistentes sobre enfermedades raras. Sin datos no hay visibilidad y sin visibilidad no hay rendición de cuentas. Seguimos entonces apoyando la implementación de clasificación internacional de enfermedades. También debemos fomentar la colaboración entre instituciones académicas, gobiernos y sociedad civil para impulsar la investigación, especialmente ensayos clínicos que entienden las necesidades de nuestras poblaciones. Las políticas nacionales deben ser inclusivas, basadas en evidencia y contar con mecanismos claros de evaluación. Y, sobre todo, debe construirse con la participación significativa de las organizaciones de pacientes y de las personas que viven con enfermedades raras. Por esto, la resolución propuesta por la Asamblea Mundial de Salud este año, que propone el desarrollo de un plan de acción mundial para las enfermedades raras, es un avance fundamental. Pero su éxito dependerá de cómo se traduzca en acciones nacionales concretas. Primero, en el desarrollo de políticas nacionales sobre enfermedades raras que aborden los principios y valores de acceso universal a la salud y la cobertura universal de salud, centrados en las personas. Segundo, en el desarrollo de capacidades para acelerar el diagnóstico mediante programas de tamizaje, la formación profesional y la innovación digital. Tercero, en el establecimiento de mecanismos y procesos para asegurar el acceso equitativo a tratamientos asequibles y tecnologías sanitarias esenciales de salud. Cuarto, en la cooperación regional entre países, entre fundaciones, para compartir conocimientos, recursos y mejores prácticas entre países y la sociedad civil. Y quinto, en elevar voces de los pacientes y cuidadores, haciéndolo socios verdaderos en la toma de decisiones. Las enfermedades raras afectan profundamente al individuo y la familia y crean desafíos sociales y económicos en la comunidad. Pero si actuamos juntos con solidaridad, se puede abordar los retos que se presentan y mejorar la calidad de vida de millones de personas a nivel regional y mundial. Muchas gracias.
Muchas gracias, doctor James, por esta excelente exposición del panorama de lo que significa tanto la situación de las enfermedades raras en general. Y yo quisiera pasar a Alexandra Hamber. Ella es CEO de RDI, más conocido como Rare Disease International. Es la persona que lidera la resolución a nivel global con múltiples actores y es la que ha ido dirigiendo todo este impulso para que haya una mejora global y esta resolución sea aprobada en la Asamblea Mundial. Ella tiene más de 20 años de experiencia en salud global y te cedo la palabra. Muchas gracias, Alexandra, por estar con nosotros. Quedamos atentos a tu exposición.
Thank you very much, Maria Elena. Thank you, everyone, ERCAL, Diego, for this very kind invitation. RDI is very honored and proud to be with you today. So I will present you somehow a bit of a background about the resolution, and I'm very pleased to have heard from Mr. James Fitzgerald already what it means for PAHO region. So I will elaborate a little bit further, and I will be joined by my colleague Deborah Bellon. She's the strategic manager of RDI. So we're going to give you a rapid overview about what is that resolution. I think there is no need to...
Excuse me, Alex, we're not watching the full screen.
Okay. Deborah, can you share you have a full display?
I think you have to exit the presentation and do it again.
Okay. My internet is complicated today. I'm in extended meeting, so my colleague Deborah is going to help to share with the presentation. Is safer, but basically I can start already. As it has been highlighted actually by the previous speaker, there are still a lot of challenges for rare diseases. There's perhaps almost no need to recall them, but often the diagnosis odyssey, the lack of capabilities to scale up treatment, access to treatment, but also having access to healthcare. So all those challenges are there. And we decided in RDI to advocate, to call for a World Health Assembly resolution. Following, I think in the next slide, we can see Yeah, so this is the current challenge that has been already mentioned: delay in diagnosis, difficulty in accessing care and treatment, stigmatization, the financial burdens often by the family, and the social exclusion. And it's very much the case in Latin America, like it is in Africa, and even also in Europe. So I think all those challenges are very common through all the region. So we felt that there was still a need to call for a global coordination to make sure that we integrate rare disease into healthcare system, to put rare disease as a priority in health. And to do that, then we decided to advocate for a resolution. And today it's going to be, it's tabled to be discussed in a couple of weeks at the World Health Assembly resolution. And the WHO will have to decide if they adopt that resolution. In the next slide, I can show you that, for example, this is very much also linked to the United Nations Sustainable Development Goals that many of you must be aware of. And we had that quote from the Director General, Dr. Tedros, that actually said that in order to achieve the Sustainable Development Goal, no one should be left behind. So including people who suffer from rare diseases, just because the disease affects a small number of people doesn't make it irrelevant or less important than disease that affects millions. So based on that, since 2018, the community worked hard. In the next slide, you can see that we had already a resolution adopted in the United Nations in 2021, but this one was very broad in a way that she also addressed social exclusion, disabilities, etc. So 2021 UN resolution on rare disease, and then there was still a need to address those challenges in terms of health it being integrated into the healthcare system. Therefore, RDI with its partners decided to call for a resolution on at the World Health Assembly. In the next slide, you'll see that this resolution has three objectives. Why, basically, we wanted it? The first one is because we still need to advance universal health coverage. And to achieve, for countries to achieve universal health coverage, they must integrate rare diseases patients in this. And this is really to strengthen public health and social measures to benefit the person living with rare diseases. The objective 2 is to strengthen the efforts of the member state and all stakeholders in order still to raise awareness. In many countries, there are still a lot of questioning around what is a rare disease. So we still need to raise awareness. We very much need to improve diagnosis capabilities, has been mentioned already, and to foster research and development for more therapies for people living with rare disease. Objective 3 of that resolution is to ensure that people living with rare disease have access to affordable, effective, and comprehensive healthcare services. And this is probably the heart of that resolution. And so to achieve those main objectives, this resolution really called for the first time for a global action plan on rare disease, which will provide a 10-year roadmap for countries to take action. So in the next slide, I will also mention that this resolution will have a global impact. Member states often, when they, at the World Health Assembly level, when they decide to really adopt an important topic, they look at the global impact. And if indeed there is a global impact, so not only geographical impact, but also even beyond health. Here we know that all the delay in diagnosis and the problem of accessing treatment creates a huge impact on the quality of lives of people and social integration. And so that resolution also comes from that acknowledgement. And the second aspect, which is very important, notably for the implementation, it would be taking into account the national context. We know that not one size fits all. We know that one global action plan will not, we know that all regions have different disparities, and that's why it will be critical in the development of the global action plan to have those regions that really inform about their realities. So Latin America, for example, will have a huge, I think, implication in really making sure that the reality in Latin America can inform the development of the Global Action Plan, but we'll come back on that. And the next slide, where we are now I'm going to give you a very quick sense of where we are with the resolution. As I mentioned, it's going to be discussed in a couple of weeks at the World Health Assembly. It has a first milestone already, because in February, the Executive Board of the WHO recommended the World Health Assembly to adopt. So this is 34 member states already that said, all right, we agree to submit that resolution for adoption at the World Health Assembly. I just wanted to also highlight the fact that this resolution is not an RDI resolution. We advocated to have the resolution, but this is a real member state-driven process. So this is 26 member states that co-sponsored the resolution. It was initiated originally by Egypt and Spain, and it had been supported by 24 member states, including several countries from Latin America, like Panama, Ecuador, Chile, Brazil, and probably other, but voilà, the list is there. The other important point I wanted to highlight is the fact that this resolution is also supported by the number actually of those organizations has increased. It's now 260 organizations, including hospital, research center, etc., patient organization, obviously, that are really calling the member state to adopt the resolution. So in the next slide, you can see the overview about the number of those organizations that came together in end of December, early January, and that really see that having that resolution would be meaningful. And it shows also something. It shows to the member state that we have a community that is extremely ready everywhere to take the work that has to be done to develop the Global Action Plan and to implement. But I'll come back on this later also in the panel discussion. The next slide just show you, the three next slide, it was just to show you the number of those organizations. They are all listed there, but we can go very quickly through it. Voilà, this is all those organizations. So it's really something. We have a movement with us, and member states then have really many organizations that can support the work. And this is a very important signal, given also the difficult context of the World Health Organization today with the financial crisis. The two next slides, we can go very quickly. And I think I'm almost done, and then I will hand over to my colleague, Debra. Yeah, I think no. The next step then it's the adoption in May, and so we will be RDI with many members in Geneva, and then yeah, we can pass those slides. This is exactly what the Global Action Plan would be, but we will discuss in the panel. So the next step is the fact that this coalition did release a call to action recently that has been sent to Dr. Tedros at WHO and also to all the different missions representative of country in Geneva to show that they're really there. We will have a side event in WHA the 21st of May. It will be also online, so if you want information to join the event, please feel free to contact us. We will know perhaps or almost on the 21st of May if the resolution is adopted. We are confident, but we know also that there are some challenges. And again, I will discuss in the panel that this will be just the start of our work, because the implementation would be critical. Having the resources and the capabilities will be essential in region to make it a reality, impactful. I think I hand over to you, Debra. Thank you.
Thank you, Alexandra. So I'm going to speak a bit about the engagement of all the stakeholders in the different regions. So I'm going to start by showing you a timeline. So Alexandra spoke a bit about what was happening next. So we have this very important step, which is the actual adoption of the resolution by the WHA, hopefully in May. And also this will lead eventually to the Global Action Plan, which is our goal in 2028. But in that meantime, this is where we really need to engage with all of you in your region and in all the regions to develop this global action plan through consultations. Because it's very important for us that this global action plan not be just a piece of paper, but be something that is really reflecting what is needed in the different regions and that involves all of our member organizations and other organizations that are allied to RDI and our members. So in terms of how we plan to engage with the regions, you can see these are the four main pillars of how we hope to engage. So the first thing is really to identify the needs and the strengths in the regions. And then after we have determined what is needed, to build the capacity in areas where we need to strengthen the resources that are there. And we need to ensure that the advocates in the regions, including Latin America, have the tools that are needed. And part of this is ensuring that the advocates can learn from each other. So peer-to-peer knowledge sharing and support is very important in this. So we know that in Latin America, there's a really long-standing history of advocacy. We have very strong members. We have very strong commitments from organizations in Latin America. And we know that there are also really strong regional networks, such as ERCAL, all of you here today. And that these are very dynamic organizations led by persons living with rare diseases and that are very committed. But we also know that there is a lot of diversity in terms of the capacity of different organizations and in terms of where different national alliances are in their progress. And so one of our commitments as RDI, and that will also be coming from the WHO, is to ensure that everybody has the technical and advocacy support they need in order to communicate what their needs are to the global level. And part of that is supporting our capacity building through engagement in the different regions. And another element, of course, is to elevate regional voices and national voices in global forums. So, for example, when we go to Geneva, we feel it's very important to bring some voices of members from different areas to Geneva to speak at that global level. But this is an ongoing aspect, of course, and engaging with the WHO regional offices and with the international offices. And so specifically for Latin America, to ensure that the voices from Latin America are heard and reflected in the development of this global action plan. So in order to accomplish this, we are creating a framework, an advocacy framework, in consultation with our members. So if you belong to an RDI member organization, hopefully you have received a survey, a link to complete a survey, but I will make sure that it's shared with you if you haven't received it. And this is really our first step in identifying the needs in terms of capacity. Because we know that there is already a lot of progress. We don't want to reinvent the wheel. We don't want to tell you things you already know. We want to really build on the knowledge and successes you've had already. And our goal is to create a global framework that is adaptable and sustainable and that reflects the needs in all the different regions and can be used and adapted in those different regions. And the goal of this framework is to empower our regional and our national leaders to mobilize their own communities towards common advocacy goals through the WHO resolution, the Global Action Plan, and then how it will work at different levels in your own countries. And then another aspect of this is to reinforce the connections and the communication within our global network. So that goes back to the peer-to-peer learning that I mentioned, to ensure that we can optimize advocacy efforts so that we're all working towards the same goal and that we're not repeating things that don't need to be repeated, but that we are also building together this advocacy future, really. And then the last aspect is really to empower our advocates to influence policy decisions by providing them with tools they need. So the first step has been our toolkit that we've created for the WHO resolution, but we will be continuing to provide tools in terms of communicating with your ministries and the WHO and other levels of policy makers that you need to be able to communicate with. So this is just an overview of how the engagement works. So at the top, you can see the Global Action Plan on Rare Diseases, which is at that global WHO, WHA level. And then there are the regional offices. So there's a specific regional office that is for the Americas. And then we have our regional alliances. So we work through our regional alliances, but also through individual national alliances. And then here we have the list of the co-sponsors of the resolution so far in different countries. So you can see that Latin America is quite well represented with Brazil, Chile, Ecuador, and Panama. And we've also had support from other members from other countries in ensuring that this WHO resolution will go through. And then we have our member organizations that work at mostly at the national level, but also international federations that are working in one disease area across national borders. So I just wanted to share our QR code. You can also go directly to our website, rarediseasesinternational.org, and you can download materials. So we have all of our materials about the WHO resolution available in English and Spanish and Portuguese. And so if you have any questions about the resolution, you're welcome to look on our website. We have a lot of resources there. So that is a quick overview. And thank you very much for listening.
Muchas gracias, Alexandra y Debra. No presenté a Debra. Debra es gerente de relaciones estratégicas de RDI. Me encanta cómo se está desarrollando este webinario en el sentido de este panorama general que ha presentado el doctor James, todo este trabajo profundo que está haciendo RDI para que se logren las cosas, y a nosotros los países y los defensores de pacientes no nos queda otra que sumarnos a este gran esfuerzo que están haciendo en estos momentos. Yo quiero felicitarlos por su trabajo, y nos toca inmediatamente el país que no se ha adherido contactar rápidamente a su misión en Ginebra, a su Ministerio de Salud, a su Dirección de Asuntos Multilaterales, y solicitar que su país sea adherente, vote favorable o copatrocine esta resolución, que es muy importante para las enfermedades raras y para todos nosotros. Yo, antes de pasar con el panel, voy a presentar una lámina para el que no ha logrado cambiar su idioma. Esta lámina les indica cómo ustedes pueden cambiar el idioma en este webinario. Entonces, hay la opción de seleccionar el icono del mundo o ir a más y encontrarlo a los puntitos adicionales que están al lado derecho del Zoom, y luego puedes seleccionar inglés, español o portugués, y al mismo tiempo puedes inhabilitar o silenciar el audio original del cual se está hablando para que escuches un solo idioma. Bueno, vamos a pasar a un panel de discusión entre compañeros. Yo quisiera presentar a Diego. Diego es director ejecutivo de FECOER, la Federación Colombiana de Enfermedades Raras. También es presidente de ERCAL, ¿no?, de enfermedades raras en el Caribe y Latinoamérica. Y ya más allá que un patient advocacy, ya es una advocacy de política global, de política latinoamericana, de política en su país, y de promover mejores condiciones favorables para las personas con enfermedades raras en Colombia y a nivel global. En este panel también se encontrará Antoine Daer, o más conocido como Tony, de Brasil, que es de la Federación Brasilera de Asociaciones de Enfermedades Raras en Brasil, y siempre nos da unas cátedras de las mejores prácticas y de las cosas que deberíamos estar haciendo otros países. Así que bienvenido, Tony, a este panel. Y continuaremos conversando con Alexandra y con Debra, con la moderación de Diego. Te cedo la palabra, Diego, en esta ronda de preguntas entre amigos. Muchas gracias.
Muchas gracias, un saludo para todos los asistentes a este espacio, a esta conversación. Un saludo al doctor James Fitzgerald y a todo el equipo de RBI, a Alex, a Debra, Tony. De verdad que es un placer y un honor siempre trabajar en estos temas de abogacía, entendiendo que esto no es un trabajo de corto plazo, venimos trabajando desde hace muchos años en estas iniciativas y yo siento mucho orgullo de hacer parte también de este equipo de miembros de RBI. Moviendo estos esfuerzos más en medio de algunas coyunturas que estamos viviendo algunos países de la región latinoamericana por cambios que en algún momento representan alguna regresividad en el acceso, no solamente a diagnósticos, sino en el acceso a tratamientos, atención integral que requieren las personas que viven con enfermedades raras. Creo que esta resolución también llega en un momento muy adecuado y oportuno, como ese llamado no solamente a los gobiernos, sino a todos los actores que trabajamos en estos temas de acceso, incluidos los grupos de pacientes, ¿sí? Entonces quisiera iniciar esta conversación con ustedes inicialmente como con un icebreaker, como con una pregunta rápida con cada uno. ¿Cuál creen ustedes o cuál es lo que les inspira personalmente o qué les inspira esta resolución, ¿sí? O la adopción de esa resolución? ¿Ustedes qué ven detrás de esta resolución? ¿Qué pueden representar para la comunidad de enfermedades raras a nivel global? Arranco contigo, Alexandra.
Thank you, Diego. I'm going to be very short because I already spoke a lot, but I was going to say really that it gives hope. I think it's the first time probably that I see so much people coming together that really understand what is at stake, that can really see the opportunity and want to grab it and to say we are here. And so that resolution really said that we are heard. I mean, for the first time, we have rare disease at the highest level in the health agenda. So this is at the World Health Organization. And so this is what it means. It gives hope for our community, I think, but hope is not enough. So by having created the coalition as well that I mentioned, 260 organizations, including hospital, researcher, etc., it shows that everyone really wants to be on board and wants to show to the member states and the WHO that they are ready to step in. The rare disease community is full of excellent, expertise. We have also some concrete solution that work. So what we need now is to look at how to scale up. What solution can we scale up, etc. So to me, that resolution, it's a policy. It can stay a paper. It's clear. It can stay just a paper, but it can also become a real impactful for change. So this is where we are. We are at this moment where we can grab that opportunity.
Esa perspectiva, gracias Alex. Continuamos con Tony. Tony, ¿qué te inspira este nuevo paso, esta posibilidad de adopción de resolución?
Muito obrigado, Diego, pela pergunta. Quero cumprimentar aqui todos os presentes nesse evento tão importante. O que mais me inspira pessoalmente na adoção dessa resolução é o reconhecimento pela primeira vez em nível global da dignidade e dos direitos das pessoas que vivem com doenças raras. Como pai de um jovem com uma doença rara e como defensor dessa causa há muitos anos, ver a ONU adotar essa resolução é um momento de profunda emoção e esperança. Ela simboliza que essas famílias, antes invisíveis, agora têm voz, visibilidade e respaldo internacional para lutar por políticas públicas, acesso ao tratamento e inclusão social. Essa resolução é mais do que um documento. Ela é um compromisso coletivo com a equidade e também compromisso com a solidariedade e a justiça. E isso me dá ainda mais força para continuar lutando. Muito obrigado.
Gracias, Tony, por compartirnos ese mensaje. Debra, ¿qué quisiera sumar a esta inspiración que nos manifiesta Tony y Alex?
Well, for me, it's really diversity and unity. Diversity because of our community, to see all the different national alliances, the international federations of all different kinds of conditions, the ultra rare, the less rare, and organizations with different levels of resources joining in a unified response and working towards the same goal. And it's also been really heartening to see other types of organizations such as hospitals, academic institutions joining our coalition and showing their support. So I think that's been really inspiring.
Fantástico, porque muchos estamos sumando desde diferentes frentes a una iniciativa que es de carácter global. Quisiera, ya entrando como un poco más en detalle, quiero confirmar si me están escuchando. ¿Está bien?
Sí, perfectamente.
Okay. Perfecto. Entrando como un poco más en detalle y entendiendo que para muchas personas alrededor del mundo es difícil entender de qué forma impacta una adopción de una resolución, ¿sí? En su vida cotidiana, en su día a día. Y quisiera preguntarte a ti, Alex, desde tu perspectiva global, ¿cuál crees que es el mayor valor que genera esta resolución para las personas que viven con enfermedades raras, en este caso, por ejemplo, en Latinoamérica? ¿Y qué hito temprano o qué podríamos esperar, por ejemplo, en alrededor de 12 meses luego de la adopción de la resolución? Porque vemos que hay muchas familias que guardan esperanza en que esto pueda mejorar sus condiciones de acceso, ¿sí? ¿Cuál es tu perspectiva en ese sentido? ¿Qué valor aporta?
Yeah, thanks, Diego. So the first thing is, we mentioned it earlier, but it's put rare disease at the highest level on the agenda of public health. So this is already a recognition by itself. It means that people that often have been left, in the shadows have an opportunity to be heard and more visible. But again, it will not just be by having the resolution that they're going to become visible. There's going to be a lot of work that we need to do. The second thing is that it will really create a political momentum for notably Latin American countries to collaborate together and to share the challenges. Also the solutions, because there are some solutions that work in country that could be scaled up and duplicated in other countries being tailored. But in the region, I'm convinced that there's a lot of potential going on. And actually, I would like to applaud Chile recently that done this amazing progress at the policy level. So, and the third is it will provide an opportunity to create a unified framework for national action. Because, and I will come back to that, there will be the development of the Global Action Plan, where Latin America country will be able, for example, to inform what are their realities, their challenges, etc. And then after, when there will be implementation means that country will have to translate into national action what that global action plan is having it. There will be targets, there will be indicators, there will be some very concrete action there that actually every country will have to report every 2 years at the World Health Assembly. So there will be also an accountability process. And then within that implementation phase and monitoring phase, the region can actually even work closer together by collaborating about the different progress, again, different action that can work. But this will not happen without the engagement of the civil society. And we heard from other disease groups that they had a global action plan, but nothing happened because there was no capabilities on the ground. So it means at national level and regional level, the different actors were not activated. There was no push. So again, like for everything that's in rare disease that happened, it's the community, the driver. And we will demonstrate it even during our side event in Geneva, where we're going to show that if we are here today with a resolution, it's because they've been so many work by the community everywhere. And it will have to continue that way. So, and I will come back again in the other discussion of the panel, what can be put in place. But, and so what we can expect in the next 12 months, first the adoption in May, hopefully, but be aware that there is a very difficult context at the moment at WHO. And if it's adopted, there will be, WHO will have to provide dedicated resources to start consulting with all the different stakeholders. We don't know exactly how they're going to do that. Usually it's formal consultation process, etc. But basically our community will have an opportunity to provide some formal submission to inform what the global action plan, etc. should be. It's 2 years, the development of that global action plan. So 2 years of development, so a lot of consultation will have to take place. So I'm sure we'll have another webinar again, definitely. But at every region, if we can have the same push, it's where we will be able to give a chance to have a very meaningful global action plan. So development phase and after implementation phase, after 2028.
Fantástico, Alex, y emociona mucho todo lo que mencionas, el poder materializar, llevar a la práctica estos resultados de esta, o lo que, o el propósito de esta resolución. Tony, Brasil lleva muchos años trabajando en impulsar políticas públicas específicas para enfermedades raras. ¿De qué forma tú, como líder de grupos de pacientes, consideras que esta resolución puede ayudar a agilizar o a catalizar la implementación de todas estas normativas, ¿sí?, en países como Brasil? ¿Y cuáles crees que deberían ser las recomendaciones que deberían hacérsele a los gobiernos, no solamente al de Brasil, sino a cualquier gobierno, para que haya voluntad política y para que se pueda beneficiar de una manera tangible a las familias?
Realmente, o Brasil tem promovido há vários anos políticas públicas específicas voltadas para as pessoas que vivem com doenças raras, com diretrizes nacionais, parcerias entre o setor público e privado e a construção de centros de excelências, como a Casa dos Raros, que já funciona há mais de 2 anos. A resolução da ONU representa um marco global e pode atuar como um catalisador poderoso ao oferecer um referencial internacional que legitima e reforça a urgência do tema. Ela convida os países a tratarem as doenças raras não como questões isoladas de saúde, mas como uma prioridade de saúde pública e de direitos humanos. Aí 2 lições concretas que o Brasil pode compartilhar. A primeira, a importância da colaboração multissetorial. Uma das estratégias mais eficazes no Brasil tem sido a construção de pontes entre associações de pacientes e instituições públicas e também empresas farmacêuticas. Essa abordagem coletiva tem viabilizado avanços regulatórios e políticas mais alinhadas às reais necessidades das pessoas com doenças raras. O segundo ponto, modelos integrados e sustentáveis de cuidado. O Brasil também tem avançado na construção de um modelo que une o SUS, que é o Sistema Único de Saúde, a parcerias filantrópicas e privadas para oferecer cuidados abrangentes e de longo prazo. Esse modelo pode inspirar outros países a pensarem além de projetos pontuais e investirem em soluções sistêmicas e duradouras. Por fim, a resolução da ONU nos oferece uma linguagem comum, pela primeira vez. Independente do espectro de cada país, dos desafios, nós vamos ter uma linguagem comum e também ela oferece o impulso necessário para promovermos mudanças concretas juntos. Ela fortalece países como o Brasil e incentiva a solidariedade global na luta pelas doenças raras.
Fantástico, Tony, e inspira mucho también ese camino que ha trazado Brasil a lo largo de estos años para países como los nuestros, porque ha logrado definir una hoja de ruta interesante y seguramente esta resolución va a ayudar a seguir impulsando todas estas iniciativas, como dices, de colaboración entre diferentes actores, que es lo más valioso que debe haber acá. Debra, desde la perspectiva, bueno, nosotros sabemos que RDI articula en este momento a más de 100 organizaciones de pacientes a nivel global, muchas de ellas de origen latinoamericano. Frente a esta resolución, ¿qué papel deben asumir estos grupos u organizaciones de pacientes para transformar el texto de la resolución en acciones que sean realmente medibles y tangibles en los diferentes países, ¿sí? Y que esto no quede solamente en el papel, ¿sí? Y también, ¿qué apoyo consideras que deben tener estas organizaciones de pacientes para poder impulsar con éxito esta resolución?
So I think that the first step that the patient organizations really need to undertake is to identify the needs. What are the main needs in their communities? And from there, what are their priorities? Because, as Tony was saying, a roadmap is really important in different countries, and we know that different countries are starting from different points. So there is no one size fits all in terms of what this global action plan will mean. And what will be really important is for the patient organizations to engage at the global level to really say what their needs are from that national perspective. And that can be done through the regional level, through the regional offices, through the regional alliances. And but it's very important, I think, that those needs and priorities are identified for each individual country so that we really ensure that no one is left behind. Because if we start from a point that maybe is appropriate for Brazil, but isn't appropriate for Ecuador, they won't get what they need. So that's something that I think is really important, is to start with perhaps a mapping of what's happening in different countries if that doesn't exist so far. And to really speak to your individual members in your countries to learn what their priorities are. And this is something that RDI will be able to help with, as I was saying, through our advocacy framework. So I encourage the national alliances and regional alliances to engage with RDI in undertaking this mapping and this identification of needs and priorities.
Muy interesante, Debra, lo que nos compartes, y también de valoramos muchísimo todo el respaldo que da RDI a los grupos de pacientes a nivel global en enfrentar o en abordar estas estrategias para poder llevar a la realidad desde el trabajo que nosotros hacemos como grupos de pacientes, iniciativas como lo que plantea la resolución. Ahora vamos para el cierre con una pregunta relámpago, una pregunta final para cada uno, donde les pido, por favor, vamos a tratar de ser muy breves, Alex, Tony y Debra. ¿Cuál acción concreta consideran ustedes que debemos proponer o sugerir a las personas que en este momento están conectadas a este webinar? ¿Cuál acción concreta podrían realizar las personas mañana mismo para poder impulsar esta resolución en cada uno de sus países? ¿Qué podrían hacer las personas que están conectadas mañana mismo para ayudar a impulsar esa adopción de esa resolución? Entonces, arrancamos contigo, Alex.
Okay, so but basically we should not be too optimistic and assume that the resolution is going to be adopted. So I would say that it's still the moment to call for member states to adopt the resolution, even more, as I mentioned, in a context of a lot of difficulties at the United Nations level with financing. So we have a call to action that has been released. We have it mentioned. So if any of the organizations that are participating here have some contact also with their member states that are still not co-sponsor, so we have 4, I think, 5 from Latin America. So we still can have more. It's still the moment to do it. So we have a template letter that can be tailored if you wish to contact the Ministry of Health. At the moment, it's still very much the Ministry of Health that is the key player. And I would say that after there would probably be some work to do in Latin America, notably with PAHO. So I was very pleased to see that a representative of PAHO was there already, but also with finance ministers. There would be the issue around the finance, about how are we going to finance, you know, the implementation of the Global Action Plan. This will be there, but let's not start with that question first. I think political will is still the key and the driver. So I would suggest that you continue with ADI and with ERCAL, with all the different also organizations that are part of the coalition. I think most of many of our members in Latin America are part of that coalition. So let's use that. Let's show that we have more than 260 organizations that come together and speak in one voice and are ready to take action. So, well, thank you.
Gracias, Alex. Tony, ¿cuál es la invitación que le harías a los asistentes a realizar mañana mismo para impulsar esta resolución?
Uma ação concreta, eu acho que todos os participantes podem realizar já amanhã, é reunir-se com seus parlamentares, ministérios de saúde ou de relações exteriores e apresentar oficialmente a resolução da ONU como uma prioridade nacional. Aí eu convido cada um a protocolar um pedido formal para que os seus países elabore ou atualize uma política nacional para doenças raras, mas tem que ser alinhada com essa resolução. Formar ou fortalecer uma aliança nacional com associação de pacientes, profissional de saúde, legislador comprometidos, porque a gente precisa colocar todos esses stakeholders juntos, né, para fazer essa pressão, e principalmente incluir as doenças raras nos planos nacionais de saúde e financiamento, o que representa um passo real estratégico rumo à implementação. A mudança começa com uma ação simples, mas firme. Levar a resolução da ONU para o centro das decisões nacionais é uma responsabilidade, eu acho que podemos assumir juntos agora. Não tem outra maneira, eu vejo. Muito obrigado.
Gracias, Tony. Finalmente, Debra.
So I encourage everybody to do everything you can, just following on what Tony and Alexandra said, to raise awareness and in a general sense. So you can participate in our social media campaign, obviously, to spread awareness of rare diseases. But I think this is something that you can do also on your own in many, many different ways, because I think it's really important for the whole global community to understand that rare diseases are not something of just a few. We are few, but we are also many. There are millions of people that are affected by rare conditions around the world. And so I think that it's important for everyone to understand why rare diseases should be and must be a global health priority. And I think that that's something that we can do at the macro level. We can do it on our social media, but we can also do it when we speak to people around us, so that they understand, because everybody knows someone who's affected by a rare condition, but not everybody knows it. So I think it's really important to show everyone in the world that we are all part of this larger community that is global and that affects everyone.
Muchísimas gracias. Y bueno, quiero como redondear o hacer un cierre con algunas palabras, sobre todo que ustedes nos acaban de compartir hoy. Inicialmente, la inspiración, nos llevamos yo creo que un mensaje muy interesante, como compartiste, Alex, de pasión, ¿no? Esto nos genera pasión a todos, no solamente a las familias, sino a todos los que trabajamos por esta comunidad a nivel global, ¿sí? La apuesta al reconocimiento de esta comunidad que ha sido históricamente aislada, pero que necesita que se mejore sus condiciones de salud y de bienestar, y esa necesidad también de trabajar en medio de la diversidad. Lo remarcabas muy bien, Debra. Creo que esto nos ha unido globalmente a todos los que trabajamos en estas iniciativas, ¿sí? Debemos seguir avanzando en ese reconocimiento para ser más visibles, en que el acceso no esté determinado por el pasaporte que tú tengas o el lugar donde vivas. El acceso tiene que ser para todos de forma equitativa. Y también quisiera cerrar con un mensaje muy importante que ustedes transmitieron, y es el hecho de que tenemos que conservar ese optimismo, ese entusiasmo, reunirnos con nuestros parlamentarios, organizarnos con nuestros grupos de pacientes que existen en nuestro país. Y una palabra muy bonita que mencionabas ahora, Debra, la conciencia, se llamaba la conciencia que tenemos que seguir generando, no solamente en la comunidad, sino en las personas que de pronto no están afectadas por una enfermedad rara. Creo que esto es una responsabilidad que tenemos todos como ciudadanos del mundo. Muchísimas gracias, de verdad que es un honor haber compartido con ustedes, Alex, Tony, Debra, y bueno, seguiremos trabajando y haciéndole seguimiento a la adopción de esta resolución allá en Ginebra. Un gran abrazo y bueno, le paso la palabra a María Elena para hacer el cierre de la sesión de hoy.
Se nos ha ido muy rápido el webinar del día de hoy. Yo quisiera agradecer en especial el día de hoy primero a los asistentes, a los pacientes, a sus familias que se han encontrado con nosotros para hacer esta exposición. También quisiera enviar un agradecimiento especial al director general de la OPS, al doctor Jarbas Barbosa, de la Oficina Regional de la OMS para las Américas, quien ha tenido a bien a respondernos rápidamente y involucrarse con el tema de enfermedades raras, lo cual me parece muy importante como un hito para nosotros como sociedad civil. Agradecer a Alexandra, a Tony, a Diego, a Debra, a todo el equipo de comunicaciones, que sin ustedes no, y de FECODER, que sin ustedes esto no hubiese sido posible. Muchas gracias, muy buenos días, muy buenas tardes y muy buenas noches.
Thank you, everyone.
Thank you. Bye.
Thank you. Muchas gracias, equipo. Gracias a todo el equipo de Pantoglot, María Elena, Ruth, David, todo el equipo de OnMedia, FECODER. Muchas gracias. Creo que salió muy bien. Estamos precisos de tiempo, pero lo sacamos adelante.
Sí.
Bueno.
Hemos hecho 1 hora exacta, en realidad, nada más que comenzamos un poquito tarde. Pero bueno.
Yo creo que ya suspendemos la grabación, creo.
Sí, hay que detener. Y si no hemos transmitido, hay que ir colgando en redes, ¿no, Diego?
Sí, sí, correcto. Creo que ya mandamos por redes, me parece. No sé, pero ¿cómo quién frena la grabación? Esto sigue grabando.
Acá yo aprieto detener. Aprieta detener, en donde dice
No,
grabar.
no me permite.
Entonces
Bueno, yo creo que
alguien más
ya
está en el
cerramos la
usuario.
sesión. Gracias,
Sí.
equipo Pantoglot, por la interpretación. Gracias a todos. Un abrazo.
Muchas
Cerremos entonces.
gracias.
Adiós.